Assalamu alaikum everyone. My name is Dr. Afia Shah. This is my second video tutorial on orthodontics. As in my first video tutorial, I gave you an overview about what is orthodontics, what are the branches of orthodontics, what is the scope of orthodontics, and why do we do orthodontics. In that video tutorial, I gave a little overview on each branch of orthodontics. And today I'm going to elaborate one of its branch that is called as preventive orthodontics. Can you see here the word itself is self-explanatory. Preventive. Preventive means we are going to do prevention. Prevention is given when there is no problem, but we suspect that the problem is going to arise. So we are going to prevent the occurrence of that problem. That's why we are calling it a preventive orthodontics. So preventive orthodontics includes education of patient and the parent. Here we educate the mother or the parent that what are the habits which are not supposed to be followed by the child, which may lead to malocclusion. If child is that at the age when he or she can understand our language, we may prevent by educating the child, we may prevent his habit or her habit, which may lead to malocclusion. And it includes the supervision of growth and development. Here the dentist or an orthodontist, what does he do? He does supervision. Supervision means he calls the patient off and on, and he or she supervise the the pattern of development and of the face, the pattern of the development of the dentition. So the dentist or orthodontist would be, this supervision will help the dentist or orthodontist to suspect what is going to happen in the future. Also, it includes the diagnostic procedures which may prevent the occurrence of malocclusion. We do prediction at this stage. We do prediction that what will be the problem in a future if this or that habit. For example, a child is having thumb sucking habit. We know that thumb sucking habit will lead to preclination of the teeth, or maybe it may lead to open bite. It may lead to prognathtic mandible. So there could be a lot of problems which may arise due to those habits. So the dentist or orthodontist tries to prevent, tries to stop all those problems in order to prevent the occurrence of malocclusion. So this, in a nutshell, what do we say? That preventive orthodontics is the branch of orthodontist which is undertaken to predict the a future malocclusion which is going to arise, and it helps orthodontists to prevent the occurrence of dentofacial problems. By definition, preventive orthodontics is a preventive measure, and that used to be taken between the age of 2 to 6 years. Means at the age of 2 till 6, the child is having only one dentition, one set of dentition, and that set of dentition is said to be the deciduous. At this time, the child has only deciduous teeth, and we do preventive orthodontics at that stage. As I told you at the back, by giving a proper education to the mother or a child, by giving a proper examination, by taking proper protocol in order to prevent the problem which is going to arise. So in preventive orthodontics, we focus on the shape of dental arches. What is the shape of a dental arch? Is the baby having early loss of teeth or not? What are the type of habits a child has? Whether the child is having habit of thumb sucking, like here can you see whether the child is having habit of mouth breathing. Can you see here the baby is sleeping with mouth open? Maybe the child is having nasal blockade, that's why the child is not able to properly breathe via the nose, and etc. So these are actually, this is the actually time when the child is at the stage of a development. The child has only one set of a dentition, and the child is not having any malocclusion present, but the child is having all those habits which may lead to malocclusion. So by definition, Graber says that it is an action taken to preserve the integrity of what appears to be normal at a specific time. Why he says what appears to be normal at specific time? As we know, there is a specific time for each tooth to erupt into an oral cavity. As we know, this is the deciduous A that will be replaced by 1. We know this is B will be replaced by 2. Means this is the deciduous dentition and this is the permanent dentition. And for every tooth, there is a specific time that will, at what time, which tooth will arrive. As we say, if you focus over here, this is deciduous central incisor, deciduous lateral, deciduous canine, deciduous first molar, and deciduous second molar. Okay, and we know in the oral cavity, the first permanent tooth which arrives is your molar 6. So at the time, at this stage, if there is any problem at this stage of dentition, at this stage from age of 2 till the age of 6, any problem which is arising during this eruption phase, we pay proper attention to the oral cavity, and at the specific time we know which tooth is supposed to erupt. If any change in that eruption pattern, if any change in any of the normal physiological structure occurs, we suspect that that will lead to problem in occlusion, means there will be no proper occlusion. So, according to Graber, action taken to preserve the integrity of what appears to be normal at a specific time. That is called as a preventive orthodontics, or a step to take preventive orthodontics. As Graber described it in some way, also Profit and Ackerman describe preventive orthodontics as prevention of potential interference with occlusal development. Means any interference, the interference could be due to the abnormal habit of a child, like thumb sucking, like mouth breathing, or any other interference which may lead to development of occlusion problem, should be suspected and should be treated before, is called as preventive orthodontics. So in preventive orthodontics, we try to prevent development of any occlusal abnormality in the dentofacial structure. What are the procedures taken in preventive orthodontics? As I told you before, the first very initial step is the parental education, because for the first time or in the beginning, the child is with the parent. The child does not come straight forward to the dentist. So like in this we include the education of a mother at her at the stage of her pregnancy. We guide the mother what are the things which a mother is supposed to watch, and what are the things she has to be cautious of, which shall not allow the occurrence of malocclusion. Then control of caries. There are different ways to control the caries. If the deciduous tooth is exfoliated before time, if there is abnormal frenal attachment, if there is abnormal musculature due to habit like mouth breathing or thumb sucking habit, or if there is a tooth which is permanent tooth which is locked and is not erupting properly into the oral cavity. And finally, the treatment with the space maintainers. These are all the steps which we take during preventive orthodontics. Procedures taken in preventive orthodontics are these. I'll be trying to explain each of these steps in a hopefully in a detailed and very easy way. In parental education, you need the parental counseling. You need to counsel a mother. You need to advise a mother. You see here the mother has not yet given birth to a child, but as a dentist or as an orthodontist, we are supposed to guide the mother how to focus on the oral hygiene of a child, how to focus on irregular habits, how to examine the oral cavity if there are decays, and we do teach mother how to feed the child, and up till what stage to breastfeed a child, what are the important food to be given to the child, at what stage which food is supposed to be taken by the mother. So these are all things which are included in the parents counseling. So before the birth, we teach the mother, before the birth of a child, one education, and after the birth of the child, again we provide education to the mother to make her that literate that she can focus on the oral hygiene of a child. One was the prenatal counseling, where the baby is not, the mother has not yet given a birth to a child. And here I told you, we are guiding the mother how to keep hygiene of the baby clean, what are the habits to be, focused on. If there is any abnormal habit like thumb sucking or mouth breathing should be noticed, and how to, what are the food which she is supposed to take, and there means like food containing calcium and phosphorus for the good health of for adequate health of the formation of deciduous teeth crown, and also like if in case the mother is having bad oral hygiene, and if that will transmit to a child, how you know mother is having bad oral hygiene, it can be transferred to a child if she is using the same spoon, if she is using the same spoon to feed her child. So all these things shall be prevented. Similarly, we give postnatal counseling where a mother is taught how to do clinical examination, from when shall she begin the clinical examination of her baby, and she is taught to start examining the oral cavity from 6 months till 6 years of age. We guide the mother, we tell her or the father or mother or any parent at what age will the first tooth erupt into the oral cavity, and how they are supposed to do examination of the oral cavity of a child. Also, we guide the mother the feeding pattern. Means for example, if a child is having abnormal habits of tongue thrusting, we guide the mother what are the things she should focus on. A child should not have this habit, maybe it will cause a lot of oral issues. We guide the mother the feeding pattern. For example, the breastfeeding is appreciated because with the breastfeeding, what happens, the position with the child makes of the or the lower jaw helps the proper growth of the lower jaw. So we focus on breastfeeding or mother feeding till the first year of age of a newborn child to avoid TMJ problem. If the mother is not properly feeding her newborn till the first year of age, the child will lead to TMJ problems. And here we also discourage, taking milk via feeding bottles, because feeding bottles do not allow a proper positioning of the mandible, and the child will have TMJ problems. Bottle feeding does not allow a proper positioning of the lower jaw, which is which shall be discouraged. And also bottle feeding may lead to occurrence of caries. So these include in the postnatal counseling. And if the child, if the due to any reason the mother is not able to give a breastfeed to a child, then we guide the mothers how means what to give. In the bottle feed they should not add the sugar, because the sugar, this is, normally it is a practice that the sugary food or sweet food or milk is given to the child, which may lead to occurrence of caries. So first of all, we try to avoid bottle feeding. If mother cannot avoid bottle feeding due to any reason, then we shall stop the parents not to add sugar into the milk and avoid bottle feeding during sleep, because these are the two reasons. The addition of sugar and bottle feeding during sleep may increase the chance of nursing bottle caries. These nursing bottle caries, these can be prevented by proper counseling of a mother. And we do counsel a mother to withdraw bottle feeding at the age of 18 to 24 months. She or she shall not give her child any more bottle feed. Only up till 18 to 24 months, if due to any reason she is giving a bottle feed to a child, she shall stop it. And then child shall come to, a diet or feeding by a cup or feeding by a spoon, but at least not bottle feeding. Then abnormal habit, we do ask mother to focus on the habits of a child. Like, can you see here, a baby is having habit of finger sucking or maybe thumb sucking. So these habits can be prevented, and these can be prevented by the application of such sort of covers which are given on over the finger, and or it can be given over the thumb or whatever the digit a baby is sucking. This all includes in prenatal and postnatal education of a mother. And also a mother is guided, or any parent is guided about the proper exfoliation time of a deciduous teeth. Sometimes what happens, that deciduous teeth, if this tooth will not exfoliate, it will not leave, ultimately it will not leave space for this permanent tooth to arise into the oral cavity. So we guide the mother a proper time of exfoliation of a deciduous teeth, and we do tell the parents up till what age all the permanent teeth will arise into the oral cavity. In case if there is any delay in exfoliation, or if there is early exfoliation, for example, this tooth is exfoliated early, what will happen due to early exfoliation? These are all the things to be guided properly to a mother in order to prevent occurrence of malocclusion. As an example, you see, if for example this tooth is exfoliated early, here is no tooth, what will happen? This and this, these both teeth will try to accommodate into this empty space. Due to this, a drifting of the teeth into the empty space, what will happen? The tooth which is supposed to arise into the oral cavity, this tooth which is supposed to arise, a permanent tooth which is supposed to arise in a future into the oral cavity, will not have any space to get erupted properly. Then this tooth will get some abnormal directions of eruptions, or it may be impacted. So the purpose of guiding a mother is to prevent the occurrence of malocclusion. We do educate the parent on how to brush the teeth and when to brush the teeth. Mostly this is, it is noticed that post breakfast and post dinner brushing reduce the occurrence of caries. So Emphasis on post-breakfast and post-dinner brushing shall be given, and we shall tell the parents about how to give topical fluoride application in case if the mother or father they see caries in the child's cavity. For example, this is the deciduous tooth and here are some caries present, okay? And the child, the mother, after the examination, mother has found caries into the oral cavity of a child, and this is the deciduous tooth. Then uh, a dentist should apply Pitts and Fisher sealant over those, caries in order to prevent, the depth of caries, or in order to prevent the decay or cavitation. So these are all the ways we guide the parent and we educate the parent. So this was the number one where we gave the parental education. In parental education, we had two things: prenatal counsel and postnatal counseling. Then number two is Caries control of deciduous teeth. Because I told you we are taking the preventive step at the age of 2 till 6. And at the age of 2 till 6, we have only deciduous dentition present. That's why we are focusing on deciduous dentition. So, Caries control of deciduous teeth. How do we control occurrence in deciduous teeth? If there is a proximal caries present, if there are proximal caries present. What are the proximal caries? The caries which occur over here at the proximal surfaces of the teeth. These surfaces, these are called proximal surfaces, like this surface. Can you see here? Proximal surface. So if the caries are present over the proximal surfaces, what do we do and how we treat and how will it cause the problem? If you focus on this diagram, this is the proximal caries. These are the proximal caries. You see, due to the caries, can you see up from here and from here, the tooth structure is lost. Earlier, before the caries, the width of the teeth were up, not up till here, it was up till here. Because of the caries, what happened? The width of the both central incisors is reduced. This reduction in the width of those lateral central incisors has left some space. Can you see here? This space is left. This space which is left due to proximal caries will allow these teeth, both the teeth, to drift into the empty space. These both teeth will try to drift into the empty space. Once these teeth will try to drift into the empty space, what will happen? The space which is required for the permanent teeth will be less. Ultimately, this drifting will lead to arch length discrepancy for the permanent teeth. This drifting of the deciduous teeth due to proximal caries will lead to tooth material arch length discrepancy. Means the arch length will be smaller and the tooth material of the permanent teeth is wider. If the tooth material of permanent teeth will not get enough space, there will be malocclusion, the teeth will be crowded, or they will be, erupting in abnormal direction. So caries control of deciduous teeth, especially proximal caries, is very important. Number two, after the treatment of this, we need to see the, what are the other caries which are present. For example, the child may need Pitts and Fisher sealant in the posterior region, or maybe the child is having more caries, so we need to give application of a topical fluoride to a child. So this all comes in a caries control. In case of this, for example, this is, can you see here a very good picture is showing you that this is the deciduous teeth, there is a pulpal involvement. Can you see here? It's this black is a decayed area, or after the decay there is, can you see here um, the periapical infection is there. This decay, which has, initiated this periapical infection, shall be treated with either pulpectomy or pulpotomy. We cannot extract this tooth. If I will extract this tooth, for example, any of the dentists, he says it's better we shall extract this tooth, no problem. The permanent tooth will arise later in the arch. No, we cannot do that because the child is still young. If we will extract this tooth due to this reason of infection or whatever, what will happen? These teeth, the adjacent teeth, will try to drift into this empty space, which we really do not want. We cannot afford, because we know a permanent tooth will erupt into this space. What if these drifted teeth will occupy the space? Where will the permanent tooth go? The permanent tooth will go to malocclusion. It will not find enough space for itself. So such cases shall be treated with either pulpectomy or pulpotomy in order to keep this tooth as a space maintainer. This tooth will behave as a space maintainer. For whom this tooth is getting or maintaining the space? For this tooth, which is going to arise in the oral cavity. We cannot extract the tooth, deciduous tooth, because we know if the deciduous tooth will be extracted, these adjacent teeth will try to drift. And we cannot afford drifting of these teeth, because we know that if these teeth will drift after the extraction of this tooth, the permanent tooth will go into a malocclusion, will not get sufficient space. So in preventive orthodontics, we try to preserve the integrity of the arch by, giving treatment to the deciduous teeth. For example, this is the deciduous tooth shown to you. See, it's a very deeply decayed tooth. This is again decayed. The tooth is decayed. We cannot extract such teeth. We can prevent by giving them, a treatment according to requirement. But we want them to be in the arch until and unless our natural teeth or permanent teeth are erupting and forcing them to exfoliate. We let these permanent teeth to apply pressure on them to exfoliate as soon as they will erupt near the bone. I hope this is clear that why do we do caries control in order to prevent orthodontics problem to arise. Now another thing, for example, a deciduous tooth is exfoliated before time. Can you see here? These deciduous teeth, these are exfoliated before time due to any reason. Maybe the child has got trauma, or maybe these teeth are retained, they did not erupt properly, or maybe the gingiva is thick at this particular area. Can you see here? This gingiva is very thick, it's not permitting the deciduous teeth to erupt into the oral cavity. Or maybe these deciduous teeth are ankylosed, they are fused with the bone. So all these things shall be, noticed, that what is the region, what is the reason behind, absence of these teeth, whether they are exfoliated or whether they are not erupted into the oral cavity. Why they are not erupted? If it is not erupted because of thick gingiva, means we need to have some surgical procedure to allow them to erupt. If they are, exfoliated due to trauma or injury, then what are we supposed to do to maintain this space, particular space? Because we cannot afford the loss of space due to drifting of these teeth. If these teeth will drift into this particular space, then a permanent teeth for sure will go to malocclusion. And there is also one reason. For example, can you see here? This picture is properly a very clear picture. Can you see here that this permanent tooth, if you focus on this picture, this is 6, the first permanent molar. This first permanent molar is given this restoration. This restoration is given to first permanent molar. Can you see here? This restoration is having overhang margins. These overhang margins of the permanent, restoration will somehow not allow this tooth to erupt. You see, if this tooth will try to erupt, these margins of or these overhangs of restoration will not allow this tooth to erupt into the oral cavity. It will form a kind of a barrier over it. So while giving restorations, we have to be very careful that we shall not give overhangs. There shall be no overhang margins of the restoration which prevent the eruption of a permanent tooth. Number 4 is abnormal frenal attachment. These frenum, this is called frenum. This is a soft tissue attachment, and the soft tissue attachment is called as a frenum. That is called frenum. Okay, this is the frenum. This is called as a labial frenum, and other frenal attachment is below the tongue. That is called as lingual frenum. Okay, if this frenum or this frenum, if they are abnormally attached, they will again lead to malocclusion. Can you see here? Normally, if you see in your oral cavity, the normal frenal attachment is up till here. The frenum is not supposed to extend down, and it's not supposed to go to the palatal side and attach to papilla. No. A frenum, the frenum is supposed to attach up to this level. If in this case the frenum is attached till the palatal side and it is attached to the papilla, due to this abnormal frenal attachment, this tooth and this tooth, they are apart, and this frenum will not allow these teeth to unite. It will lead to midline dystema. What will happen? This midline dystema will not allow subcutaneous teeth to erupt properly. Means it will not allow the accommodation of permanent teeth. It will not allow permanent teeth to accommodate properly and will ultimately lead to malocclusion. So such freni shall be treated with surgery. We need to remove this frenal attachment which is abnormally down, and we need to treat such cases surgically in order to prevent the malocclusion. Similarly here, if you see in the diagram that this frenum, the lingual frenum, is attached with the tip of a tongue. This is the tip of a tongue. Normally the frenum is not attached with the tip of a tongue, but here the frenum is attached with the tip of a tongue. That is called as tongue tie. This frenal attachment is called as tongue tie, and that is called also ankyloglossia, ankylosis of a tongue. So these abnormal positioning of a tongue due to a tongue tie or ankyloglossia will again lead to malocclusion. Now, abnormal musculature. These muscles, why these muscles are abnormal? There are several reasons that if your musculature, because our teeth are surrounded by a cushion of muscles, if these muscles which are surrounding your dentition or your jaws, they are not in a harmony with teeth and jaw, they will lead to malocclusion. First reason of abnormal musculature is prolonged breastfeeding habit or bottle feeding habit. You know, these prolonged habits of bottle feeding and breastfeeding will continue the infantile swallowing pattern of a child. You know, there are two patterns of swallowing. One is infantile swallowing, which is done by infants. When the child is growing, this swallowing pattern has to be changed to allow proper growth of the jaws and a proper accommodation of the teeth over the jaws. The prolonged feeding habit via breast or via bottle will not allow to switch from infantile swallow to the adult swallow. This abnormal swallowing pattern will be causing abnormal musculature, and that abnormal muscular activity will lead to malocclusion. And if the child is having this habit of tongue thrusting, throwing tongue forward, the child is throwing tongue forward all the time. This abnormal habit again will cause the abnormal musculature. So as I told you before, that the feeding habit, bottle feeding or breastfeeding habit of the child should be stopped at the age of 18 to 24 months. The child is not, supposed to continue bottle feeding and breastfeeding after this age, because a child switch has to switch to the adult swallowing pattern, or has to switch from infantile swallowing pattern. The habit of thumb, digit sucking, or a lip sucking again cause hyperactivity of muscles. If you focus on this picture, this habit of a child, can you see? Thumb sucking habit. Due to this thumb sucking habit, if you focus on this lip, lower lip, the lower lip is resting over a thumb. This resting of a lip is producing some abnormal pressure over here at this particular region where the mentalis muscle is. This abnormal musculature, due to this thumb sucking habit, will not allow a proper growth of the mandible, will not allow mandible to grow properly. Number one, this hyperactive muscle, which is over here, due to the thumb sucking habit, the mentalis muscle will cause, will itself apply a pressure over the mandible, and this pressure of the mentalis muscle will lead to crowding of anterior teeth. Why anterior teeth will be crowded? Because this mentalis muscle, which is hyperactive over here, will apply a pressure over the jaw, and that mentalis muscle will not allow mandibular arch to grow properly. This decreased mandibular arch growth will lead to crowding. For example, mandible was supposed to grow like this. This hyperactive muscle is not allowing the mandible to grow properly. Due to this abnormal activity, what is happening? The mandibular growth is reduced. Now mandibular growth is reduced, the arch length is reduced. Now what will happen? When the arch length is reduced and your tooth material is not getting enough space to get proper accommodation, then ultimately it will lead to crowding. Again, it's a very clear example over here. Can you see here, due to this habit of thumb sucking, what is happening? The lip is everted. The everted lip is actually causing hyperactivity of a mentalis muscle. Here is actually a mentalis muscle. Can you see here? This picture is clearly showing you this hyperactive mentalis muscle. This mentalis muscle is hyperactive over here. This hyperactivity will not allow the mandibular jaw to grow properly. And this reduced growth will not allow accommodation of the teeth, and that will ultimately lead to malocclusion. This is because of hyperactivity of a muscle. But can you see here again, there are a lot of other issues which are occurring due to thumb sucking habit. This tooth is getting into proclination, this tooth is getting into proclination, and due to continuous pressure of the thumb, these teeth are, pressed into the socket inward, and these are also pressed inward due to infraocclusion. These are an infraocclusion. This infraocclusion, why do we call it infraocclusion? Because the teeth are not well erupted because of the continuous pressure. This pressure of a thumb is pressing the teeth back into the sockets, not allowing the proper eruption of a tooth. This pressure, inward pressure, can you see here this inward pressure? This thumb is applying a pressure, inward pressure over a teeth. This will lead to this. The open space is left. Because of the pressure, the teeth are not well erupted. The space is open between the teeth where the thumb was present. That will lead to open bite. This is open bite. And again, open bite is a problem. So in preventive orthodontics, we try to focus on all those issues. Again, now number 6 is treatment of locked post permanent molar. Can you see here again? This picture is very clear to you that sometimes the first permanent molar gets locked. It's not well erupted into the oral cavity. Here is the deciduous tooth. This is the deciduous tooth. Here the first permanent molar is locked due to any reason, and it is not erupting well into the oral cavity. It is not properly erupting into the arch. So we need to give some space to this tooth to erupt into the cavity. Where it is locked, the distal surface of this deciduous tooth is actually not permitting it to erupt well into the oral cavity. So what do we do is, after the proper examination, after the radiographic examination, we came to the conclusion that this distal surface of the second deciduous molar is not permitting this first permanent molar to erupt. So what am I supposed to do? I will do some slicing, some stripping or some slicing like this. This is the stripping or disking or slicing, whatever you say. We need to slice, or we need to cut. Not cut, but a proper term is we need to do stripping or slicing of this distal surface of a second molar tooth in order to leave the space for this permanent tooth to erupt into the oral cavity. I hope it is clear up till here that why are we doing this stripping or slicing, because we want this permanent tooth to erupt into the oral cavity. Please do understand the thing that slicing is not that simple. If we do over slicing or over stripping, this overstripping may lead to sensation of the tooth, because in deciduous teeth the pulp horns are quite wider. So we have to carefully do the stripping or slicing in order to prevent sensitivity of a tooth. And after slicing, we do give topical fluoride therapy to the child. Now the seventh thing, when the tooth is abnormally exfoliated. Can you see here in this picture? This is first deciduous molar, and there was supposed to be a second deciduous molar. But the second deciduous molar is exfoliated because of any reason. Maybe it was absent into the oral cavity. Maybe a child had a trauma, or maybe it was grossly caries which we could not maintain, which we could not keep into the oral cavity, or whatever the reason behind. And this tooth is exfoliated before time. Now, what do I know? That if this tooth is not here, then the teeth which are present adjacent to it, they will try to drift. For example, this is the empty space, and I'm not giving anything over here. What will happen? This tooth will drift over here, and this first permanent molar will also try to drift into that empty space. What will happen if they both will occupy the space? What about this tooth? Where will it get the space into the arch? If it will not get proper space into the arch, it will go to malocclusion. It will erupt abnormally, more buccally, or maybe it will be retate, it will not erupt. So there could be a lot of problem which will arise. So what I will do in this case, or what an orthodontist do in this case, orthodontist will try to give this sort of appliance. This appliance is called as a space maintainer. Can you see the appliance is open from the center, and there is a metal frame going around, okay, and that is bonded over the first permanent molar tooth, and this space is left open in order to allow this tooth to erupt easily from this space. At the same time, this appliance is preventing this first molar and second or first permanent deciduous molar oh sorry, first permanent molar and first deciduous molar to drift into this space. So these space maintainers, they prevent the loss of space. They prevent the drifting of the adjacent teeth. Also, they maintain the space for the permanent tooth which is going to erupt. So we are giving space maintainers due to premature loss of any tooth. We need to prevent the integrity, or we need to prevent these teeth to drift into the space, or we need to preserve the integrity of our arch. In this case, we need to give space maintainers to the patient. So we said, after a parent education, we talked about how to prevent the caries. Then we said if the teeth are exfoliated early, and we said if there are abnormal habits like thumb sucking, digit sucking, abnormal musculature, they were all leading to problem of abnormal occlusion. Here we talked about if we need to maintain a space, or due to exfoliation, early exfoliation of a tooth, we are going to give a space maintainer appliance. So I'm going to talk about space maintainer appliance in a detail over here, that when to give space maintainer. Is every case suitable for space maintainer? Or at what time do we give space maintainer, and what type of a space maintainer is required at what stage? So there are some factors to be considered before giving space maintainer. Number one, you have to think about the elapsed time. Maximum loss of space occurs between 2 weeks and 6 months of tooth loss. It means when there is a tooth loss, the space will the space which is present will be only present between 2 weeks till 6 months. After this time, the adjacent teeth will try to drift into that space and will occupy the space. These teeth will try to drift into the space and they will occupy the space. That means that we shall think of when to begin or when to give space maintainer. We shall not give longer time after the extraction or after exfoliation. We cannot leave the arch for a longer time. We shall plan quickly about the space maintainer in order to avoid drifting of the teeth into the lost space or into the empty space. Then number two, we shall see the dental age of the patient. If the premature loss of the deciduous molar is at the age below 7, if there is a loss of a deciduous molar at the age below 7, that will lead to delayed eruption of permanent tooth. Premature loss of a molar at the age below 7 generally lead to eruption by more than 1 year. And if the premature loss of a deciduous tooth is after the age of 7, they may lead to premature eruption. Premature eruption of what? Premature eruption of 6, the first molar. Because we know the first molar erupt at the age of 6. If the deciduous molar is lost before the age of 7, then there will be delayed eruption of the permanent tooth at that space. But if the deciduous molar is exfoliated after the age of 7, then there will be premature eruption of the deciduous of the permanent tooth which is going to erupt at that space. So please do concentrate on these 2 points. I hope I am I have cleared it to you, and please you just read it once again, then you will understand what I'm trying to explain. Then number 3, amount of bone covering. How much bone is covering your tooth? Can you see here? This is the permanent tooth. This is the deciduous tooth. And you need to know, for example, this is, can you see this is the tooth which is treated, that is restored tooth. And, this tooth is working as a space maintainer right now. This deciduous tooth is working as a space maintainer right now. Okay, so we need to see, this is the tooth bud. This is called a succedaneous tooth, which is going to erupt. This succedaneous tooth bud is covered with some bone over here. If you see that a very less, bone is there, and this is going to erupt within few months into the oral cavity, then we can extract this tooth. At this stage, we can extract this tooth when we know that only 1 millimeter is 1 millimeter of the alveolar bone is left over the top of this deciduous tooth. We can, this is the bone which is covering this tooth. This tooth is present under the bone, and that is the deciduous tooth that is restored. Now what I want to do is, I want to see what if I extract this tooth. But I cannot extract this tooth blindly. First, I have to take a radiograph. On the radiograph, I want to see how much the bone is covering at the top of this tooth. Because 1 millimeter, the movement of this tooth, 1 millimeter movement of this tooth takes 3 to 4 months or 3 to 5 months. This tooth will take 3 to 5 months to move only 1 millimeter. If I extract this tooth and I am not giving any space maintainer, then these teeth will try to drift. Then I'm pretty sure that my permanent succedaneous tooth, which is very near the bone and will not allow these teeth to drift into space, then in that case, I can extract this tooth. I can extract this tooth. So we need to see how much bone is covering over your permanent tooth bud. And if the permanent tooth bud is very near to the alveolar bone, then we can, extract this tooth. If it is very low and there is a lot of bone covering, then in that case, we will maintain this space either via giving restoration to the deciduous tooth, or if we cannot restore this deciduous tooth, then we will try to give a space maintainer. Also, there is another indication where we give a space maintainer when there is a congenitally missing tooth. For example, this tooth is missing congenitally. It's not exfoliated. By birth, it is not present into the oral cavity. For example, this tooth is not present by birth into the oral cavity. What we will do in that case, we know that our permanent tooth is supposed to erupt at this space. So we will give a space maintainer over here to prevent this tooth and this tooth to drift into the empty space. Okay, and we will be maintaining a space for our succedaneous tooth to erupt into the oral cavity. Number 5, we need to see the sequence of teeth eruption. It is very important to know what is the stage or what is the sequence of eruption of the permanent teeth, and we need to know what is the time of eruption of a permanent tooth. So the tooth bud that is supposed to erupt at the space created for it due to premature loss, for example, there is a premature loss of a tooth and we want to maintain the space for a permanent tooth. So we need to have two important conditions. There are two clinical conditions where we need to maintain the space. Number 1, for example, there is a loss of deciduous E means second molar. If the deciduous second molar, can you see here, this is the first molar and there is no second deciduous molar. If the second deciduous molar is exfoliated due to any reason, but premature loss, there is a premature loss of deciduous second molar. We know that at the space or at the space of E will be replaced by 5, the second permanent or second deciduous, sorry, second permanent premolar. That is called as 5. So here the E is exfoliated early due to any reason. And we know that this space will be in future occupied by eruption of our second permanent premolar. So I need to give space maintainer over here in order to prevent the loss of space. So due to the premature loss of E, the permanent molar 7. Now how, first of all, we need to see that whether we need to give space maintainer over here or whether we cannot or we shall avoid a space maintainer. So in radiograph, what we will do, we will take some radiograph. In radiograph, we will see that this tooth is lost, E is lost, the 5 is there, 6 is not yet erupted, and 7 is also present in the bone. We will see the level of eruption. This second molar, this is first molar, this is second molar, and this is premolar. What we will do is we will see that if the level of permanent second molar is higher than the level, can you see this? I drew this line. The level of 7 is higher. The level of 7 is higher than the level of 5. Then there are chances that the 6 will drift into this space. Okay, I'm repeating again that if the second deciduous molar is exfoliated due to any reason and the 6 is not yet erupted into the oral cavity, I want to know whether shall I give the space maintainer or not. What I will do in a radiograph, I will see if the 7, which is beside 6, okay, if the 7 means second permanent molar is at the higher level than the level of a 5, means second permanent premolar. If this level is higher than the level of 5, then my first permanent molar, there are more likely chances that this first permanent molar will drift into this space. Okay, so I shall think of a space maintainer because this tooth will drift into this space, so I shall give a space maintainer. If there is a premature loss of first molar, here we say the premature loss of second deciduous molar. Now this is another scenario where there is a premature loss of first deciduous molar. First deciduous molar, this is second deciduous molar, the first is lost. And there is a premature loss of a first deciduous molar. In this case, what will happen? Can you see here? This is the central incisor and this is the lateral incisor. These are the deciduous teeth with blue, and with the white, these are the permanent teeth. First permanent, first means central incisor, and this is, there was supposed to be a second incisor, lateral incisor, and this is the canine. In this case, where the first deciduous molar is lost before the time or early exfoliated, what will happen? The premature loss of deciduous molar and erupting permanent lateral incisor. Here the erupting permanent lateral incisor, sorry, this is the lateral incisor, I'm extremely sorry, will lead to distal ditching of deciduous canine. What will happen here will be the lateral incisor. Lateral incisor will be applying pressure to the permanent canine, or sorry, deciduous canine, and that deciduous canine will lead to distal ditching. This is actually C. This is the deciduous canine. This is the central incisor. This is the lateral incisor. This lateral incisor, the permanent one, will be applying pressure over the deciduous canine, and deciduous canine will be forced into the space, will be applying pressure over the adjacent teeth and will lead to distal ditching of a deciduous canine. This distal ditching of a deciduous canine will be causing infection of a second premolar. I'm repeating it again. I think I'm not clear. Second molar, deciduous. First molar is exfoliated. Due to early exfoliation of second molar, what is happening? Erupting permanent incisor is here. Erupting permanent lateral incisor is here somewhere here. This erupting permanent lateral incisor will be applying pressure over the deciduous canine. Okay. This erupting lateral incisor will be applying pressure over this deciduous canine. This deciduous canine will lead to ditching, distal ditching. This distal ditching of deciduous canine will ultimately lead to infection of second permanent premolar. This is another scenario. Due to this, the impaction of second premolar will occur and will ultimately lead to malocclusion. Then we need to see what is the stage of the root development. Then we need to see, means these are all factors which are we are watching whether to give space maintainer or not. So we talked about several factors to give the space maintainer. These are actually the factors we are talking about whether to give space maintainer or not. So one of the factor to give space maintainer or not is stage of root development, means at what stage your root is developed. Okay. And eruption of the permanent teeth in the opposing arch. Can you see here? This is the empty space, and we need to give space maintainer. But the problem is that this tooth of the opposing arch has erupted more. That is supra erupted. This is called supra eruption. It is erupted, supra erupted, and due to its supra eruption, it will be causing problem in the opposing arch. And in this case, we will design a space maintainer that shall have some other component inside that will be called as occlusal stop. So in this case, we do give the space maintainer, but the space maintainer will be modified. For example, this is the space maintainer I'm giving to maintain the space, and I will be giving at the top of this space maintainer some kind of a stop that is called as occlusal stop. That occlusal stop will not allow the supra eruption of this tooth. So this is another factor which we need to consider. What are the ideal requirements of a space maintainer? These space maintainers, we are saying space maintainers, they are maintaining something. What are they maintaining? They are maintaining